Okay, the movie I'm going to discuss is called Gifted Hands. This movie is about the world-renowned pediatric neurosurgeon Ben Carson. And Ben Carson, this movie is more of a bibliography, but it's also a drama, classified as a drama. But it's about his work as a pediatric neurosurgeon at Johns Hopkins. So the movie begins with Hopkins with this huge dilemma where they want him to separate these conjoined twins that are conjoined in the occipital region of the head. And this is a big dilemma for him because it's never been done before where both babies live. So that's how the scene starts out, and he gets a lot of pressure from his colleagues about him performing the surgery, and he's very hesitant about it because he's very passionate, and he does not want both babies, to have to choose between the children, infants. So he comes up with this technique to save the babies. But I think that this film really does illustrate a healthcare worker's grief, I guess, that they bring home with them on a daily basis. It shows him just, really taking this home with him and talking about it with his wife, and I think I can relate to this, I guess, because as a nurse, it's very difficult to leave your work at work. You see patients, and they're troubled with so many problems and the outcome of their disease and the reality of it. So it's, I find myself so many times just coming home with my patients' problems, and just, when you can finally get away from everything and take a break, and you can see him doing this as well, just really struggling with it. There's just a lot of emotions, I think, working in the healthcare field that you have to, you end up bringing home with you as much as you try not to. I think it shows how much stress there is working in healthcare, and the pressure to deliver solutions to your patients. Another issue in the film is, as Dr. Carson is an intern at Johns Hopkins, he's doing rounds with the head physician, and they come into the room and they discuss openly to a patient about not even to him, in front of him, about how the patient's going to be crippled, and the patient's visibly shaken by this news, and the team begins to talk about he's going to have surgery in the morning, and I think this part of the film shows something to be true, unfortunately, is that you see too many times, at least I have, where physicians come in the room and they talk to patients about patients, and it's no secret. It shouldn't be a secret, I guess, of what the patient's outcome is of their disease, but it's not done in a caring, loving way. It's like the patient isn't even there, and they'll talk about this patient is going to be crippled, and and then they go on about it. And I think so many times this happens like it does in the film, where it's just there is no compassion, there's no filter, and patients are just not given the option to really talk about things or speak their emotions or ask questions. I think sometimes doctors forget to treat patients like emotional people. Patients are vulnerable. They're scared. They're emotional when they're in the hospital, and when they're given difficult news, sometimes I don't think it's done in the best way. And also in the same scene, Carson, he questions the head neurosurgeon's decision to have this patient undergo surgery tomorrow, and the head surgeon, puts him in his place because Carson, noticed that the patient's anemic. So, obviously that would be a huge risk to undergo a brain surgery and be, anemic. So I think this part, I think shows how, as nurses, obviously it happened with a physician in this case, but as nurses, I feel like there's a lot of times where we question the doctor's order, for the patient to receive this type of treatment or undergo this procedure, or take this medication, take this dose of medication. And I feel like a lot of times what happens is it's just like, I'm the doctor, you're the nurse, kind of you get put in your place. And this issue, I feel like, is about, healthcare workers need to work together, ultimately, to achieve the patient's highest level of safety and care. And this doesn't always happen, unfortunately. I think sometimes, doctors will come in and it's just like they're the physician, not, and you're below them, and that's not how it should be. And it's interesting for me to see this scene because you don't see that with doctors as much, with their ranking. You see it between doctors and nurses and nursing care techs, where they're put in their place. But I think this scene shows how, it's not always a team effort. It's just you get blown off your concerns, for the patient. And, the patient's outcome is really what we're all working towards, so we should work together. Another dilemma in the movie is where there's, Dr. Carson is he's a resident at Johns Hopkins, and he's the only resident on site. So a patient comes in where he's beat with a baseball bat, and the patient, is not going to survive unless Dr. Carson does the surgery. But as a resident, he can't legally perform the surgery because there's not, a head physician and attending on site. And the head nurse there, tells Dr. Carson to go ahead and do the surgery. And Dr. Carson does go through and do the surgery. The patient survives. And I think this shows, how nurses advocate for their patients. Even when it's not the book answer to go ahead and do something, I think, we try to advocate for a patient and put the patient's concerns and safety first. Unfortunately, this is a very tough situation, and I think it just, once again shows what healthcare workers go through. It's life and death, that you're dealing with, and it's very stressful. But I thought this was really cool just to see how, the nurse pushes once again for the patient's safety, even though, it doesn't seem safe, resident performing a surgery, but knowing that, the end result is, is death. There has to be a better option there, and I think it's interesting to see how the team does work a little bit together there to save this patient's life. So overall, the theme throughout the whole movie is this idea that you can achieve great things if you put your mind to it, and ultimately, with God, all things are possible. I think in the healthcare arena, we leave God out. And this is something, to me, that is so important. I pray with my patients daily, and sometimes pray with them. I pray to be a better nurse. Pray to give the right medications, not to do something wrong to a patient. And we need to, in my opinion, we need to include God in the healthcare field. And I think so many times it's just, you're not allowed to. You're not allowed to say anything about God. And I think this film was really cool just to see how Dr. Carson is able to do so many of these great things, and every time he's praying to God for help and asking God for help. And I think there would be so many more achievements in medicine if we allow God to step in and help us, to make His presence known. So I think this film intentionally points to God and how God can bring our success in difficult situations. So to wrap it all up, I guess, overall this film's purpose was to detail the life of Ben Carson as a neurosurgeon, and I think it does a great job of showing some examples of what healthcare workers go through and the stress of working in healthcare. It depicts a lot of the problems that we face on a daily basis, and how we grieve our patients' battles. I think it also shows the intensity, like I said. So overall, all the dilemmas are fixed with hard work and prayer. So I think this is a great film to watch, and I really enjoyed it.